Hello to all, I'm Dr. Arti and today we are going to talk on a very interesting and common topic that we all hear about or talk about, and that is the anxiety disorders. You must have seen people are talking about anxieties, okay, like she's suffering from anxiety or I'm suffering from anxiety, I have generalized anxiety. So we generally use this term and there is like, or we can say we sometimes change it with fear. Okay, I fear, you can say exams, or I fear answering interviews. So same thing is actually anxiety, because it is like you like apprehending about what might go wrong in the future. That is called anxiety. We are going to learn how anxiety and fear are slightly different. Okay, let's move on. Let's start with the introduction. So as we know, it's a most common psychiatric condition in general population. That is around 20%. Okay, 20% is the population may suffer from anxiety disorder one point in their life, or it can occur in childhood also. Okay, while anxiety is a normal response to stress, okay, it becomes pathological when it causes significant impairment in your day-to-day life, whether it is your school, education, whether it is career, personal level, you are not able to take care of yourself, or whatever responsibilities you have. Okay, any of this personal, social, you can say work-life balance may get impaired, and that is for around 6 months. It's not a short duration. So according to the DSM-5, DSM, that is Diagnostic and Statistical Manual, 5th edition, says anxiety, to diagnose somebody with anxieties, according to the specifications, it need to meet the criteria for 6 months. Okay, symptoms are written in DSM-5. So if it is met, it has to be 6 months. Less than 6 months, we cannot say is like person is suffering from anxiety disorder. We can say he is having a panic attack, okay, or some other kind of thing. In this, today, we are going to discuss about all types of anxiety disorders. Basically, in DSM-4TR, we had 9 disorders, okay. Now, it has come to 7. Why? Because 2 of these disorders, that is obsessive compulsive disorder and post-traumatic stress disorder, has been moved to another diagnostic criteria, like it has moved into another chapter of DSM-5. Okay, so also like when we discuss about 9, we are going to see all 9, and we will see their major symptoms, causes and treatment as and when possible. Okay, we'll distinguish between what is normal anxiety and what you can say clinical anxiety. So normal is what we generally face. Okay, we are going to see it in detail. Okay, and how it affects our daily life, that we are going to see. Let's move on to our next slide. Let's understand now. We say fear and anxiety means the same. I am like fearing to answer an exam or something like that. We can say I'm having anxiety to answer my test. Okay, so what is the basic difference? We cannot completely differentiate them. Okay, like this is anxiety and this is fear, but it's like some distinction, like some way we can distinguish them. One, it is a reaction to specific observable. This is the key term, that is observable, the things that you can see. Suppose the snake is there or the car is approaching towards you, okay, in a very fast speed. So seeing it that, you get fear and not anxiety, because anxiety is like apprehending something might go wrong, like thinking about future. You don't have so much time to think like what may go wrong. So it's like you know the snake is there or car is approaching, you have to quickly move out. So it's like natural response occurs. So it is observable, while anxiety is a diffuse, unfocused, okay, future oriented, like there is a lot of planning, thinking going on. Like for example, you are answering an exam, you know it well, and it is not like, it's like it has come within a minute. Okay, so this. Second, like this is an example of snake, height or water. Okay, this is actually, you know, and here worry about initiating a conversation in an interview, answering questions, making calls to somebody who may be senior or something, okay, you are fearful of, but you are having apprehensions about it, okay. So that relate to a known or understood threat. It's like you know it and you're aware about it. Here, the fear is largely unknown. Okay, you don't know exactly what might go wrong, but you can think about it, or you're like making a plan about it. When there is a fear, suppose when you see a snake, it's like fight or flight response may occur. You may run away from this, okay, or fight with the situation. While here, create chronic sense of worry and tension. Means you are like constantly worrying about things going wrong, me like being failed or something like that. Anything that goes wrong, you think about it continuously for long duration. That is called anxiety. I hope this is clear. Next is, what is normal anxiety and anxiety disorder? This may be also a question in your mind. We have seen fear and anxiety. Now, there is something called I have anxiety and like she's suffering from anxiety disorder. Are two different things. How? We'll understand. When say normal anxiety, it is like you can say state. Okay? You can say it's a state anxiety. When you entering into any stressful situation, like for example exams, interviews, or anything, okay, it's like you know things are going to change and they are going to change for some particular time, okay. So it is like situational. You get worried or tense because of some reason. That is called normal anxiety, occurs in relation to specific fear, okay. You can see here trait anxiety and state anxiety. State means you are in that state or position to be of you can say anxious, and trait anxiety means it's a predisposition in you throughout. You are meant to be anxious in whatever situation might occur, okay. Like always worried, like I'm worried about answering an exam. That is one kind. I'm worried about reaching late to the college. I am worried about cooking my own food and getting it tasty. I may be worried about my finances. I may be worried about, you can say, dressing up. I may get worried about any tiny things. Okay, that is called trait anxiety. That is what we have talked about. So, that is when we know something is going to change within some time, it is called normal anxiety. And anxiety disorder, as we know about, it's about 6 months. It should be affecting your life significantly in major areas, okay, major areas of your life, like your personal, social, emotional, you can say your job environment, everything is going to affect, okay. Again, coming to normal, it is short lived. Normal anxiety is short time. Here it is 6 months. Doesn't significantly interfere with daily life, okay. It's not regularly, it is situational. And then response when stressor is removed. You become fine when that particular stressor is gone. But here it's like persistent fear, okay, without any trigger. Even there is no stressful situation, you are not having any exam, nothing is going on, still you are worried whether will I get up on time tomorrow, whether will I get the bus tomorrow, whether will I can speak or make friendship with this particular person. I am worried about any normal situation with other people may not be. Like 80% of the people may not be worried about tiny things, but this 20% people who suffers from anxiety disorder may get anxious throughout, okay. So that is the difference between normal and anxiety disorder. I hope this is very much clear to you. Hello everyone, I'm Dr. Arti. I'm here today to thank each one of you for watching our videos, okay. We deeply appreciate your time that you have invested in watching our psychology related videos, your engagement, your continuous support, okay. inspires us to continuously create valuable, meaningful content that is related to psychology. Your every view, that every moment that you spend with us, okay, motivates our team to deliver the highest quality content regularly. To watch this video and many such videos as full lectures, please visit our mobile app, okay, at app.drartisite.com, our website drartisite.com, where you will get educational articles, okay, educational resources related to psychology and answer to many of your questions related to psychology field and careers in psychology. Also, for any of your queries related to psychology, please feel free to contact us at email confidant@drartisite.com.